A question that comes up a lot for people who are not on the journey yet, but are getting ready to start the journey, they're going to be getting immediate, healing, temporary. Those three words are interchangeable. They all mean the same thing. The pair of dentures that you get right after extractions. And then several months later, maybe even a year or more later, you will get your permanent dentures. Not to be confused with implant supported dentures, but just that next pair of dentures that is going to be your dentures for the long haul. But for people who are getting ready to start, the question that is how long should I leave my dentures in immediately after extractions? There is no one size fits all blanket answer to that question. Each dentist has their own way of doing things. So one dentist may say 24 hours, another may say 48, another may say 72. My dentist said 72, and I have seen answers in the denture support group where quite a few dentists say 72 hours. But that answer is going to vary as far as what your dentist tells you to do, depending on your dentist. And some dentists may not even tell their patients at all how long they should leave their dentures in. I guess they figure that's something that their patient knows by osmosis, and they figured it out on their own, even though they've never been through this journey before. It's important to follow your dentist's instructions to the letter, because they do know what works in regards to immediate dentures. If you're not given any information, at the minimum, I would say keep your dentures in for 24 hours. It's important. I know I've seen people who comment, well, I took them out after a couple of hours because they were uncomfortable. I couldn't keep them in. They hurt. They were uncomfortable. There's no way I could wear them. That's normal. You have just had, or you're going to have, because you're getting ready to go into that phase, you're going to have X amount of teeth pulled. I had 28 teeth pulled and then got immediate dentures. It is going to be uncomfortable. They're going to feel weird. There's going to be pain. Those are all normal things. You just had a major procedure done. So those are the things that you're going to feel. If you take those dentures out before you start to heal, you're kind of going to defeat not even kind of, you are going to defeat the purpose of healing dentures. Healing dentures act as a bandage. They compress your gums down. They help with the bleeding. And also your gums form around your dentures. So the longer you're wearing them for, the more your gums are molding into those dentures. If you take them out after 2 or 3 hours and don't put them back in for days, if you can put them back in days later, because your gums are going to swell. Having immediate dentures helps with that swelling because they really don't have anywhere to go. What I was told to do, I wore them straight for 72 hours. Did not take them out at all. Not to clean my mouth, not to do nothing as far as removing my dentures to clean my mouth. I still cleaned my mouth. Dentures in. I still took a toothbrush, toothpaste, brushed all of the areas of my mouth not covered by my dentures. Did a rinse and spit, like, just kind of rinsed my mouth. And then I didn't even spit. Spit, don't use the word spit. I drooled, drooled the water out, because you don't want to do a full-on spit when you're I don't know if it would affect anything underneath the denture if you're wearing your denture. I wasn't taking any chances, but you don't want to spit when you have healing gums, because you don't want to do anything to disrupt the healing, the blood clots and the stuff that are on your gums. So I just kind of let the water kind of just drool out, because I was told not to spit, so I didn't spit. I was really, really careful about that, and wore them straight for 72 hours. Then after the 72 hours, what I was told to do was to wear them for 6 weeks after that, to only take them out twice a day for no more than 5 minutes a day, to clean my mouth, not brush my gums during that six week period, because you don't want to disrupt the blood clots, cause anything to go wonky, and to risk dry socket. So you got to be really, really careful, but that's what I did. 6 weeks, wore them all of the time. Only took them out twice a day for no more than 5 minutes a day to clean my dentures, to clean my mouth. Just kind of very carefully brush all of the areas of my mouth that were not covered with my dentures during the day, and then used alcohol-free mouthwash to kind of just sit in my mouth. Didn't do much of anything. As a matter of fact, I more went like this, just to kind of shake it, because I didn't want to and do anything to mess with the blood clotting on my gums. So I just kind of like shook it instead of swished it, and then drooled that mouthwash out, because a full-on spit, you don't want to do anything to disrupt those blood clots and risk dry socket. So that's what I did. Everybody's going to have a different way of doing it, but it is very important that you wear your dentures for a period of time after you get your extractions and you get immediate dentures. The longer you wear them for, 24, 48, 72, whatever your dentist tells you, whatever you choose to do. If you aren't given instructions, if you choose 24 hours or 48 hours or 72 hours, it's important to do that. Don't take them out after like 2 hours because they're hurting and they're uncomfortable and they feel weird and they're bulky. Those are all normal things. You want to make sure that you are giving your gums an opportunity to heal. And I know a lot of people will say, well, I healed without immediate dentures. And that's great. As someone who healed with immediate dentures, I honestly can't imagine doing it any other way. I have never eaten without my dentures in. And I feel that for me personally, I adjusted better to having dentures because I did wear them for quite a long period of time before I got used to taking them out for any length of time. So my gums had an opportunity to form around my dentures. My muscles in my mouth had an opportunity to adjust to them. And I've never eaten without them, so I've never gotten into that habit. And I'm not going to call it a bad habit because it's not. But a lot of people get into the habit of eating without their dentures in because it's easier. I don't know if it's easier because I've never done it. But if you aren't kind of pushing a little bit with your prosthetic teeth to get to where you can eat, you're never going to get there. So taking them out to eat because it's easier is going to defeat the purpose of having dentures. So anyway, I hope that answers the question. Kind of feel like it's a fuzzy answer because it's not a set in stone answer. Every dentist is going to give their patient different advice. But my advice is follow your dentist's advice, even if it's uncomfortable, because that's how you push through it. If they are digging after a few days and they are still causing you issues, talk to your dentist about that and get them adjusted and taken care of. But the first few days are going to be a major adjustment period. So they're going to feel uncomfortable and they may dig. Your gums are swollen. So your dentures are going to dig into those swollen gums. But once the swelling goes down, things will get easier. Not easy, but each day will bring a little bit more of an easement in what's going on, and it'll get easier, not easy, but each day we'll see progress of some sort. And remember, every time you have just any progress, any small victory, celebrate that and pat yourself on the back, give yourself a high five. You're doing great. I'm gonna go ahead and go, and I'll talk to you later.